So let's look at functional range of motion. To get to your hair, you need 90 degrees, right? So if you're getting to about 90, 100 degrees, like you're relatively functional, right? That's really huge, setting expectations for function. You don't have to have that much external rotation, right? Because you can wash your hair over here. You don't have to wash your hair over here. So this is, full external rotation. Internal rotation is actually one of the hardest things to do. So it's hard to get someone to get full external rotation. So how much external rotation would you expect someone to get at her age? Is maybe to like wipe her butt to get to her lower back, belt wise, pulling pants up and stuff like that versus all the way up. So it's really, really important to set expectations of what you expect. People who have total reverse shoulders usually do it for what reason? First and foremost is setting expectations. Really, really huge. Because your expectations and the doctor's expectations sometimes differ. And it's very, very important that you set the expectations with her. It's very important. I've had this problem before. So setting expectations. Okay, so then so we know we want function. And what we want is function as she sees it. Function as she sees it and function as you help her to see it. It's very important. Because sometimes they can be false expectations. And I had this guy, gunshot wound through the shoulder, and somehow or another the doctor told him he was gonna get functional motion, okay? His function was like this. Doctor's function was like this. Completely different functional expectations. And so that's why it's so important to ask them their own functional expectation. Have them show you with their good arm, and then that way you can set it. Right? It's huge because they're going to be upset with you. They're going to talk shit about you. The doctor is wonderful, but you might be thrown under the bus. I mean, sometimes the doctor's thrown under the bus, but you're there to save the doctor's ass, but the doctor's not always there to save your ass. Be like, no, your therapist is wonderful. It was me. No. Like, no doctor ever in my life has said that to me. So setting their expectations is really functional. So she's got comorbidities. Osteoporosis is one of them. Osteoporosis. So you have to be careful with like how much you're pushing, right? To a certain extent, right? You gotta be careful because you don't want to overdo it. You have to understand why she went for the surgery. So she had an ORAF that failed. So it was from a healing standpoint. A lot of pain, right? So majority of the time, people are going to those types of surgery because of pain. So the expectation has to be, going back to expectation, that we want a certain amount of motion and a function based on pain levels. So we don't want to get more motion at the risk of more pain. We'd rather have functional motion and no pain, right? Or very little pain, right? Functional motion without pain is usually the goal. So even if you have less motion but no pain, that's where I'd rather be with you, right? So if she has decreased supination, what's the problem? Work backwards. Not functioning bicep. Where does the bicep originate and insert? Who is your strongest supinator? Your strongest supinator is your biceps. Your supinator muscle is this big. Your bicep supinator is this big. So if you can't supinate, why? Is your biceps not working that well? Is it tight? Is it weak? Is it painful? Where does your biceps originate? Your biceps has a long head and a short head. Where are they connected in this surgery? What did they do? They had to cut it and pin it somewhere. So now your biceps has been affected. Very important to get op report if possible. But you know that majority of the time in a total reverse shoulder, something has to happen to the biceps. So your biceps, you got your long and your short, and so the long is probably not long anymore. But yeah, if something is going on in your supination, it's because of the biceps. So then what can you do to help the biceps, you know, so that it can supinate again? It's possible. It's supposed to, because the biceps also helps with some elevation, right? So we've got to reduce that pain down, reduce it down. You can work the tissue in a shortened position, get the pain to reduce. Sometimes I'll do some overhead like this without the biceps to kind of let the biceps relax a little bit. So in this case, she had a reverse shoulder for pain and poor healing. So her rotator cuff is questionable. So I had a guy who rotator cuffs were like a mess. So usually I like to ask the doctor what they see in surgery in terms of the rotator cuff, which ones were intact, which ones were not intact, or the quality of the tendon. I repaired it, but the quality of the tendon is not good. You're going to have a insufficiency in the way those tendons work, and therefore you're going to have less like results, you know. So you're not getting functional. You're getting functional like 90 degrees. So you know what? If I bend your elbow a little bit and you reach up, you're going to get that functional motion that you wanted. And then I'm going to work on rotations, you know, because with rotation brings more function. With rotation, internal and external rotation brings more functional flexion. But with you're going to be limited in your external rotation with reverse shoulders, right? You're not looking for this. You're looking like 30 degrees. You just want 30 degrees, 30 degrees. But you want it pain-free. That's key. So, you know, you want a certain amount of but like at that range, you don't really need, like, who cares if it's forward flexion, if it's abduction, or it's scaption? It's functional at this point. Good case review. I love this stuff. Look at that. So, yeah, and then triceps. The forgotten muscle. Triceps huge because it helps stabilize the scapula too. You know, because where does the tricep originate? And where does it insert? Believe it or not, when you work out the triceps, it will help with the biceps. And it will help with forward flexion. Because if you're tight coming up here, guess what's stopping you? Here. Triceps. Work that triceps out. Boom. Like, oh. Good case review. Love it.